Hi, my name is Financial Coach Ruthy and I'm an RN in Alberta. And thanks so much for watching my previous video about LAPP. I wanted to continue on with the financial literacy for my fellow healthcare workers and nurses. So I have 10 tips today on money tips for healthcare workers. So number one is carefully scrutinize your pay stub. Have a look and make sure that you're paying or getting paid appropriately for each thing, whether that's night shift differential, evening, weekends, if you're working extra on call or you're having to come back or get a call back, that sort of thing. Also look at all your different deductions and make sure that you know what those mean, how much you should have taken off for CPP and for EI, and what the maximum amounts are for those as well. And if you don't have any idea, that's okay. You can always ask a friend. There's no shame in asking any questions about your pay stub. I have numerous examples of mistakes that unfortunately payroll has missed, or ESP, or a combination of both. And since it's your money, you really need to pay attention. I have one friend who works 5 night shifts in a row and every 6 weeks, and for some reason that 5th night shift always gets dropped and she doesn't get paid appropriately for it. So please pay attention to your pay stub. Another example is sometimes they can overpay you. I've had that happen for myself. So when I went from part-time to full-time, they still thought for some reason that I was getting the pay in lieu of the stat on top of getting the stat as well. So I got that extra 5%, which equated to about $100 a month. And unfortunately, I wasn't paying close enough attention. And this continued on for 4 months before they noticed and said, hey, you owe us $400. So that was a big chunk of money that needed to go back to Alberta Health Services. So make sure you pay attention to your pay stub. Number 2 in my money tips is make sure that you sign up for the employer matching RRSP, or tax-free savings account. It's really important to make sure you sign up for that, even though the forms can be super overwhelming and you're not even sure where to begin with those forms. And the reason is because even though it's only 2% matching, it doesn't sound like a lot of money, but that 2% can add up very quickly. For example, for myself, 2% roughly equals about $100 a month taken off my paycheck, and my employer pays $100 towards my RRSP or TFSA. And that has equated over the last 10 years to roughly $30,000. So if you don't fill out that paperwork and you don't start the ball rolling on that employer matching 2% or more if you want, they will only match up to 2%. But if you don't get the ball rolling, then you're missing out on this extra pay and on these extra benefits involved in being a healthcare worker. So please sign up for those. And if you're really confused as to how to fill those out, ask someone. Or I also have a course that I'm doing in January, and it's for how to wealth like a Canadian nurse. And we talk about in detail how to fill out those forms and what are the different things that you're invested in with Manulife. So have a look at that if you're interested. You can have a look at my website, www.financialresuscitationwithruthy.com. Number 3 is make sure that you budget. I know a lot of people find budgeting tedious and boring, and they feel like they're really constrained. But I find it actually really freeing because I know where my money is going. And especially as an RN, I find that we make a really good wage, and we shouldn't be living paycheck to paycheck. We make enough that budgeting should be just one of those things that is so easy for us because we have enough left over, obviously, that we should be able to make our money work for us and be able to have some savings and investments and that sort of thing. So make sure there are like different options that you can use to budget. You want to start with your basics when you're budgeting, your food, your clothing, shelter, transportation. Make sure you can actually get to work so you can work and make some money. And there are different methods that you can use for budgeting. So you can use a good old-fashioned pen and paper. You can use Excel. You can use spreadsheets. Myself, personally, I use an app called Mint because it syncs with my bank account and it syncs with my credit card and my investments through Manulife. So whatever you want to do with that, you decide what method is best for you, but make sure that you are budgeting. So you are telling your money where to go instead of wondering where it went. Number 4, just like we tell our patients, we also need to be good example and good role models for our patients of good health. So make sure we take care of our bodies, and that means exercising and eating healthy. Now, I know that's difficult, especially after an 8, 10, or 12-hour shift of being on your feet, and during COVID times, it's especially difficult on our mental health. But I think it's really important to get that extra cardio in at least a couple times a week and get your heart rate up. And I think that's going to benefit us in the long run, financially and for our mental health as well. So financially, there are so many ways to do it for a lower cost. It doesn't have to be expensive. You don't have to go to expensive fitness classes or have an expensive gym membership. In fact, for myself, you can go running outside in the summertime. There are apps that you can help, like Runtastic or Adidas, or different things that are free. There's also on YouTube, there's tons of free workouts. And my favorite is Fitness Blender. I've been using it for about 8 years now, and there's so many different kinds. There's 500 different free workouts that you can use, and they vary in length of time from either 10 minutes to an hour to half an hour, whatever you want. You can pick what you want. There's also like HIIT, there's cardio, there's Pilates. There's so many different things you can do. There's even like a skipping rope one. So you decide how you want to do it, if you want low impact or high impact. All you need basically is an exercise mat and some weights. And I personally use these POWERBLOCK weights, and they were like $150 at Canadian Tire for the 2 sets, and they're really portable, and you can just put them in one place in a small room, wherever. They don't take up a lot of space. So that's the great thing about those. I know there's lots of different excuses that we can make. I made a lot of different excuses before I had children, but then once I was realizing that I need to actually put this into practice, I would get up at 5 in the morning, go for a run, and then I would go to work for 7 o'clock in the morning. And while I was at work, my kids were at school, and then in the evening we would spend family time together. So really 5 in the morning was the only time that I could make it work, and so you have to find a time and commit to it. Another reason for it financially also is that I see a lot of our seniors that are paying a lot of money towards medications, and that just breaks my heart. I see them with different comorbidities, with heart disease, diabetes, and I see them paying like $300 a month, and that's their cost, their portion of the 25% of Blue Cross that they're paying. So I don't want to be paying that when I get to be a senior citizen. I would rather spend that $300 a month on something fun, whether that's on my grandchildren or going on vacation. But I don't want to be giving it or donating it to pharmaceutical companies or paying for my medication. So number 5 is sort of similar to number 4, and that's meal planning, making sure that not only are we exercising, but we're also eating healthy. So as nurses, I think it's really easy to get into the habit of eating a lot of donuts because people drop off Tim Hortons donuts or muffins or whatever. So it's really hard to eat healthy, and we're rushed, and we don't have a routine necessarily. So I think you need to take the time outside of work to set up some batch cooking or meal planning ahead of time. For our family, we set up on like Sunday nights, cut up a bunch of vegetables, put them into jars or containers so they're set up for the week. You can easily do a whole chicken and throw that in the crock pot, cover it in poultry seasoning, salt and pepper, and a little bit of oil. And you put it in the crock pot, stick it on for 8 hours, and you come back home and it's ready to eat. And you can easily use that the next day as well. Use that same chicken for chicken sandwich or whatever you want to do with it as well, for leftovers for lunch. But yeah, it's really important. I use an app called COZI, and I can plan all my shifts on there. I can put all the different work locations that I'm working at, and I can also meal plan on that. I think that's like the best app ever, along with Mint, to plan your life out and be organized. And not only has it helped me be organized, but just being able to exercise, eat healthier, you feel better, your mental health is improved, and your pants fit a little bit better. So that's a plus as well. Number 6. This is unrelated to the health aspect, but it has to do with courses that we have to take to keep up our professional license. And part of that is some of the courses aren't covered by Alberta Health Services, and we have to pay out of our pocket. So for example, maybe a TNCC course or an ACLS course, and those are quite expensive. Some of them are $300 to $500. So what you can do is you can apply for funding or reimbursement through ARNET, so ARNET. And I've done that myself, and I paid $300 for a course and ended up getting reimbursed $200 for a course. So it was totally worth it. I think the hardest part was keeping the receipt and making sure to fill out the paperwork. So make sure you look for those opportunities to do that. Number 7 is get to know what's in your union handbook and what your employer rights are and what you are allowed to have for, say, paid education leave days or personal leave days or vacation. Did I already say that? I think I did. But yeah, different things, how many sick days you can have, just so that you are aware of what you're entitled to as an employee. And I think it's really important to speak up for yourself and make sure that you are getting not only paid appropriately, like we said in number 1, but that you are taking those days for education appropriately as well. For example, I applied for a course that I recently took, and I saw on ESP that I got paid 5 hours for the vacation, 5 hours for education and 3 hours out of my banked overtime. And I asked my boss about that, and I said, or my manager, and I said, why is there some out of my overtime bank? And she had looked into it, and I didn't realize that in my education leave bank, she had looked at it and saw just the number 5 and thought that was hours, but I guess it was days. So if I hadn't spoke up, I would have just lost out on that. And so it's very important to speak up and find out what you are entitled to receive as an employee. Number 8, for anybody who has student loans out there and they're wondering how they're going to pay them off, even though we make a good wage, it can be overwhelming to have those student loans. So there is the option in Alberta anyway for student loan forgiveness for northern or more remote communities. If you work there for at least a year, I believe there's about $4,000 that you can get forgiven on your student loan. So that might be an option for some people who are able to move. There's even some less remote places that you can work at. For example, myself, I'm only an hour north of Edmonton. I don't consider us really remote at all, but there's that opportunity if you want to take advantage of it to potentially get reimbursed or student loan forgiven about $4,000 a year just for working in a northern place. So that might be an option for you. Number 9 is to set up some sinking funds. Now, a couple of years ago, I had no idea what sinking funds were, but they have been a lifesaver for me. So what is a sinking fund? Well, it's taking any of your major life once a year expenses, and like, for example, our nursing registration, that's over $600, Christmas, birthday presents, home and auto insurance, if you pay that once a year, might be your car registration, that sort of thing. So add up all those things together and then divide it by 12 months, and you have your monthly sinking fund, or whoops, I forgot about this fund, ready to go when you need to take advantage of it. So for example, in my family, we have added that up, and it works out to be about $500 a month that I have to set aside in a different fund, ready to be used at any time when Christmas comes or birthdays come or this nursing registration comes up. So make sure that you kind of have that set aside so that it's not a surprise and it's not a sense of panic. Instead of it's a sense of relief that you know that money is sitting there waiting to be used for those purposes. So that's really important to have sinking funds, just to have that sense of financial relief, I would call it, because you know that it's going to be there and that you've planned for that. And number 10 kind of goes a bit with the budgeting aspect. So what you need to do to achieve budgeting is what you need to do in order to make sure that your budgeting is going to be effective, a goal that you're saving towards. If you don't have a goal that you're saving towards, then there's really, no sense of purpose for your budgeting. And also with that goal, you also have to have a why. Why do you want to save up for that goal? Because if you don't have a why, then it sort of defeats the purpose, I guess. Why do you want to retire someday, or why do you want to invest? So that you're comfortable later on in retirement, or if you want to buy a vacation home, or if you want to leave a legacy to your family. So those are some things to keep in mind when you are budgeting, but it's also important, number 10, to have a goal and to have a reason why you want to make sure you achieve that goal. And another way to achieve that goal and to do with your budgeting is to kind of have a sheet laid out that you put on the fridge, and it's something that will be a visual reminder for you of what your goal is and what you're working towards. And because it's on your fridge, you can see it every single day. For my family, we had one on our fridge. We wanted to pay off our mortgage quickly so that we could go traveling as a family. So we kind of divided it up, how long it would take to pay off our mortgage. And each month when we put extra money onto the principal, we would color it in on the fridge and we would see where we were making progress. And that just really helped to motivate us to reach our goal, which, by the way, we reached in January of 2020, right before the pandemic. So woohoo for us, we were able to reach our goal. So yes, it is achievable to have goals, and it is possible to do these things and have some financial things that you should be working towards. So anyway, if you have any other ideas that you would like to hear advice about, or topics that you would like to hear some tips about, please feel free to send me a message or message me on Financial Coach Ruthy, either on Instagram or Facebook. And watch for another video coming up, so please subscribe to Financial Coach Ruthy on YouTube if you are interested in hearing more about investing. I'm going to be doing 7 tips on investing for healthcare workers.